And so, yeah, we're recording now just to let you know. And I think that's everything. There'll be plenty of opportunities for participation. If you do have any burning questions, please do put them in the chat. I'll be monitoring the chat. And then at the relevant times, we can stop and address those. Great. I'm going to move on to the next slide and introduce Daniel.
Thank you, Christina. I hope everyone can hear me and see me okay. My name is Daniel Stavro. I'm Assistant Director for Education and Equalities at the Council for Disabled Children, and I oversee this particular program, the Early Years SEND. I'm going to join Christina and thank you for turning up today on a Monday morning. It's also really nice. I think I recognize 2 or 3 familiar faces from previous sessions and events. I'm just going to say at the end of today, Christina is going to share some information about upcoming events, including one which we have this week in Birmingham. So certainly do keep an eye out. And this is my humble plug for that event. It would be really good to kind of reinforce this community of practice. So in respect of what we're hoping to do today, I'm shortly going to share with you a relatively brief presentation around the ordinarily available provision and how it applies to the early years context, and hopefully give you a bit of a flavour how it fits in kind of the lived experiences of practitioners and children's. We're then very lucky to have with us a speaker from Cumbria to share some experience and reflections from their local area of the work on OAP. And we will have an opportunity to share a bit between you, with quite a few, good number of people in the room today to share experiences of OAP in your local area. We'll then have a short break and then move into small group conversations around OAP. And we're quite purposefully trying to share with you what I think is a kind of honest representation of how OAP looks and can look on the ground, including trying to touch upon some of the challenges. Then we'll share the main points of conversations in the groups within the wider forum. And then Christina will start summing up with some reflection on why we believe OAP is so important. And then we'll bring the session to a close. We should be able to finish by midday, and I hope you'll find the day interesting. I just want to make one kind of overarching comment, I suppose. Being such a large group, we're approaching 90 in the room at the moment, inevitably there will be different levels of understanding and familiarity with the topic of OAP. What we're aiming to do today is to hopefully be able to bring benefit to pretty much people across the spectrum. We will certainly have to begin with some of the basics. I hope those of you are well familiar. I hope you'll bear with us. And feel free to jump in and make comments and additions as well. But as I said, we're also not going to shy away from the more controversial or challenging aspects. I'm also going to try and locate OAP within the wider sort of conceptual framework. What does it mean about inclusion and inclusive practice? I hope kind of all levels of knowledge coming into today's sessions will manage to benefit from the session. And of course, we'll be very keen to hear your feedback when we finished. I think that's probably by way of introduction. Christina, are we okay to move on to the next slide?
Yeah, please do.
Thank you. Now, you will probably be quite familiar with the setup. I can only see a very small number of you. So please, if anybody does feel they want to come in, don't stand on ceremony. Christina's monitoring the chat. If you put your hand up and you want to make a contribution, even better, please do so. As is the custom at the Council for Disabled Children, we really make a point of making sure that we're keeping the children and young people, in this case, young children, at the heart, at the centre of conversations. What I don't want to do is to go on a kind of conceptual, theoretical level and lose sight of children. So in order to make sure that's firmly cemented in our mind, I've provided a case study which I will return to shortly. This is not a real case study, but those of you working in the sector will probably recognize it as a realistic one. So N is a 4-year-old boy, loves playing with Lego and animals, does not have any pets at home, Introduction into reception class has been severely affected by anxiety. We know from quite a lot of research nowadays, anxiety is actually a really big issue, and at surprisingly young ages, especially post-pandemic. I've kept the case study purposefully quite thin, so not to get bogged down with too many details. You probably get the general gist of it. Let's keep it in mind, and try and kind of superimpose that on the content as I deliver it to make sure that we are reflecting back on the experiences of children. Before I move on, however, just to make one more point, I am kind of formally launching a quest for more case studies. So I'll be really interested to hear as we go through today's session if there are other case studies you feel would be helpful for us in these kind of presentations moving forward. So again, just an open invite for you to share with us. Okay, so many of you will probably not need this slide in a general sense because you probably know the definitions. Nonetheless, it's a good idea to start from kind of the basics. And I also want to refer in a moment to the relative nature of these definitions, which make OAP a really important pillar of the system. So some very general definitions. A learning difficulty really relates to significant and greater difficulties in learning than others, namely the peers in somebody's learning group. A disability which prevents or hinders somebody from making use of facilities in daily life. The disability, as described in the Equality Act, talks about impact being substantial and long-term in that case being 12 months or more. And special education provision means educational or training provision that is additional to or different from, and you've probably heard this phrase, additional to or different from, than what's made generally for others at the same age. So the first point that comes to mind from these definitions are that special education needs to an extent is a circular definition, namely you're deemed to have special needs if you require special support. So there's no objective kind of line in the sand where somebody passes a threshold. It really is a question of practitioners and kind of the system determining what would be additional to and different from. And secondly, and most importantly for our context today, this is what we call a twice relative definition. It's relative on the one hand to the peers of said child. As I mentioned before, you have special needs. If in order to support you adequately, you will require more support than people around you, basically in a classroom or small group of learning. And it's also relative because it's compared to what is generally available, or what we are now today calling ordinarily available provision. In other words, as the provision which is made generally available becomes more extensive, fewer children will need additional to and different from. And conversely, as that provision becomes narrower, more children are expected to need more. Thanks, Christian, and let's move to the next slide. Thank you. This is simply a metaphor which I'm going to employ to try and kind of use another form of learning and content. So in this particular metaphor, the universal provision is the shade made by the parasol. You could say that the parasol itself is the OAP system. And as you would expect, the wider this parasol is, the more needs would be met under it, as it were. And conversely, the narrower, the smaller the shade provided by the parasol is, fewer children will enjoy its protective shade, and fewer will receive support for their needs as part of that. And what happens next is we need to put specialist, individualized forms of provision in place for these children who fall outside of the shaded area. Again, this is now becoming an extended metaphor, and in this extended metaphor, we're talking about things like sun hats, protective cream, and possibly even a separate shaded space, by which I'm trying to invoke the notion of children taken out of that mainstream provision and provided for separately, either in a side room or possibly even in a specialist setting. I'm just going to pause here for 1 second and make sure that everybody's happy and kind of comfortable with the basics as I presented them and the accompanying metaphor. Good time now to shout out. I see a couple of thumbs up. That's great. That's really appreciated, by the way. Keep them coming in the interactive input. Perfect. Okay, Christina, let's move on to the next slide, please. Okay. It is now probably a good idea to try and locate the OAP system within what we usually call the triad of intervention. Many of you will be familiar with this. I would say it's not even unique to the world of education. You certainly see this in social care and health as well. I'm just going to quickly, really for the purpose of making sure everybody's along the same lines, going to quickly go over the basics of each tier and then try and as I say, locate OAP system within that. So the universal level, this is where OAP, generally speaking, resides. This is what we have as matter of course, should be provided within the mainstream system to all pupils, including those who might have additional barriers to learning, if I use a very generalistic kind of terminology. As I say, this is an important point. If for no other reason, then OAP is supposed to be, for instance, provided for from the general school or setting budget. Okay, so universal level is really kind of that basic level where everybody should expect to get the same. The targeted level is where services supplement and complement what schools and settings can do by themselves. And it's probably helpful for me to provide a couple of examples. So the kind of things I'm thinking about over here are, for instance, a speech and language therapist coming in to deliver a small group on social skills, possibly an education psychologist coming in to give some advice for staff as opposed to working directly with pupils. Some of you might be sitting here chuckling away thinking this is not realistic because I know provision is really scarce, but those things do happen and certainly should happen probably more often than they do. And also just to say that the targeted level can also bring in colleagues from outside the world of strictly speaking education, so people in social care and health as well are part of this picture. One more point before I move to the specialist tier is that the targeted layer, which is provided in schools and settings, might be seen slightly differently from within the school and outside the school. So the school might know, for instance, that we're bringing in a speech and language therapist from the outside, commissioned externally, and they will see it as targeted. Parents and the wider community around school might simply see this as part of the universal offer because that's there sort of as given. So it's probably worthwhile considering those nuances and considering who is asking the question, because it's not always the same answer necessarily. And then finally, at the specialist level, these are generally speaking services provided on an individual basis to particular children where a particular need profile has been highlighted. I often say that in the parlance of the school staff room, I never worked myself in early years, but certainly in schools and colleges, this is what people in the staff room would usually call one-to-one. So for instance, you have, and this is oftentimes associated with ECP provision, so a child would be provided for 8 sessions of occupational therapy clinic a term, and that is very much in the arena of specialist provision. So as I say, for the purposes of today, it's very, very important to remember that OAP really resides within the universal level, but we also need to acknowledge that the other levels are important in respect of that, because the targeted tier, for instance, is very commonly used to triage pupils who there's a suspicion there might be a high level of need before we sort of pass them over to the specialist at the one-to-one level. So they are all obviously interlinked as well, and there's more to be said about it, but probably not in the constraints of the time we have today. And again, I'm just going to pause for a second to give participants a chance to ask any questions or make any comments. I can see somebody already put their hand. Helen, was that? I saw a brief hand up. Any question for me?
No, sorry, click the wrong option. I was going to.
Okay, so it's a thumbs up. Perfect. I'll take it. Thank you, Helen. Okay, this might be a question, Charlotte. I think it's Charlotte with a hand up. Would you like to ask a question?
Yeah. Oh, yes. Hello there. Sorry. I was just saying the specialist provision, it would be with an EHC plan, wouldn't it?
Yes, I would say that almost always that's the case. I mean, I suppose we're talking about two different sets of definitions. The specialist really is describing a particular type of provision, and we're talking now about the way that comes about, namely the funding stream. It's almost always the case that specialist provision will be funded and arranged for by an ECP. Having said that, I have known also in cases for different reasons that there's not an ECP in place, and a way has been found to provide a specialist support, for instance, by privately funding it. But you're right, generally speaking, that's what you would see. So specialists almost always equates ECP provision. Thank you. I think there was another question from Samira.
Hi there. Just a quick question. I'm assuming that these figures on your next slide are for EHCPs in schools and not necessarily in the early years. Is there a split between the number of EHCPs that were created in an early years setting versus what was created in the school?
Yes, hi Samir. First of all, really nice to see you again. There is a split, and we can share with you at the end of today's presentation where to access this information. It's all on the DFE dashboard. I think you got a glimpse of the next slide, and if I remember it as well, I'm going to make a point a bit about kind of the division of figures between early years and schools as well. But fair point, and we can send you a link to the DFE's dashboard.
Thank you very much.
Christina, was one more question up somewhere? I think I might have missed.
There was a hand up, but it seems to have gone down now. So unless someone was willing to speak, I think we can move on. Oh, Karina.
Oh, hello, can you hear me?
Yes, we can.
Hiya. I just wondered if there's a national standard for what ordinarily available provision should look like, and at what point that becomes more targeted or maybe isn't enough by a setting, if there is a kind of a metric, or if you like.
Yeah, thank you, Corinne. And that's a really, firstly, good question, but also a timely one, because you might be familiar with the EYSEND and AP improvement plan, which was launched back in March. It's almost a year ago now, unbelievably. And there's a change program underway to try and enact it. One of the sort of main pillars of this plan is precisely around articulating national standards for OAP. I'm going to talk about that a bit later today, but to give you, I didn't want to leave you without an answer. So what I will say is this, two things. So one is what I just mentioned. This is in the plan and it's supposed to happen. The time frame presently is supposed to be by the end of 2025. So and there's going to be an election between now and then. So I cannot say for certain if and when it will happen. But there is a plan for that, and it's been recognized as something that probably should happen. The other part of the answer is that presently these standards are set on a local area, local authority basis, and we are now training still on the current system, if that makes sense. So the whole point of some of the work we do with local authorities is to make sure that they are setting out clear expectations for their setting. So at the moment, basically, it's still set locally. There's an ambition and a plan for it to happen nationally, and I'll touch upon that a bit later. Karina, I hope that's okay as a kind of interim response, and I'll come back to that a bit later in the presentation.
Yeah, thank you. What was the name of that plan? Sorry, the SEND and EP?
SEND and alternative provision.
Okay, thank you.
Not at all. Thanks for the question. It's a really good one. Okay, let's move on to the next slide, Christina.
Yeah, let's move on. There's a question in the chat, but I think maybe we can address it at the end of the presentation.
Okay, give me a shout if you feel it needs addressing separately. Okay, so this, as Samira pointed out, these are the figures which we updated not that long ago. 2015, of course, is an important point of time because that's basically where EHCPs kind of kicked in as a system. They took over from statements of special needs, for those of you who have been long enough to around to remember. One thing you can certainly see graphically, and this is one of the reasons I quite like this slide, is that there's been a very constant, steady year-on-year increase in the level of applications for ECPs. We're standing at roughly kind of a between 7 and 9% increase year on year. The numbers are really quite huge, so we're well over 500,000 now. And Samira is right, these are the figures for schools and early years kind of within them. Two figures I can give you now about the earlier specifically. In the latest period of data, which we have from DFE, new applications for ECPs were almost a quarter of all new applications. So that's really quite huge. New applications for early years, that is. So between 0 and 5, almost a quarter of all ECP new applications were for that age group. So obviously there's something disproportionate going on and quite a bit of concern. And within the general numbers, I think we're looking at something like 14% of all ECPs. And like I said, but happily, excuse me, we can share with you the data that's come out regularly from the DFE. One thing which is really important to state here now, and I'm going to put this kind of in the background of all our conversation, is that ECP costs are by far the single most important contributor to the financial stresses faced by local authorities. I'm sure you almost have to be blind not to see this. There's so much talk in the media at the moment about local authorities facing basically bankruptcy, and this is a huge chunk of their expenditure. This is a good point for me to clarify one point. We will be talking about the relationship between having an effective, robust, co-produced, well thought out OAP system and the financial pressures in the system. And to put it in very, very simple terms, there is a belief that if there's a better OAP system in place, if we can address more needs, genuinely address them, is what I mean, at the universal level, an OAP system, there will be, it stands to reason, there will be less of an increase on this regular, ongoing, almost baked in increase in ECP application numbers. And I think that's a fair assumption to make. Having said that, we are clear that we are not advocating to use the OAP as a cost-cutting mechanism. And certainly, we also know and understand quite clearly that even if a local authority today enacts a very good OAP system, the change will not filter into the system for quite a while. So this is not a change of overnight. We will not begin to see the change in ECP numbers very quickly. It's simply one of the main necessary steps is not sufficient in itself, and I hope that's clear from the outset. This feels like a comment maybe I should attend to. Christina, can you just help me with the comments in the chat if there's anything I need to be aware of?
Yeah, so there's a comment in the chat that the age ranges have changed now for EHCP applications, I expect, from 0 to 4 and 16 to 25. Is there any data about 4 to 16 as a comparison to old statements?
No, the data we have is between 0 and 5. As far as I know, I need to look into, maybe there might be other secondary research. As far as I know, the data is between 0 to 5 and then the other age ranges. But again, we can happily share with you, this is publicly available information and it's collated on a regular basis. Okay, so what I'm going to do now is I'm going to try and go back to our case study, and there's a reminder of the kind of the basic skeleton of it on the screen in front of you. And what I would like to do is just to take, and we really don't have long for this, so we'll do it relatively briefly, to ask you some questions on this case study. And I'm going to concede over here that the questions appear to be slightly leading. Obviously, there's a very particular rationale behind them. So I'm just going to ask the questions now and invite you to make contributions. Contributions in the chat are welcome, and Christina will have a look at them. Having said that, I do find that it's quite often nice to have contributions from the room, and gives you a bit of a break from my voice and just kind of generates a bit more of a conversation. So I've set out the case study. We don't know a whole lot about the boy, but we know, I think, enough to kind of understand the general gist of the challenge. And we're really interested to hear your thoughts on what kind of responses might be appropriate from staff, and what impact might the absence of such responses or provision have on the needs of child N. So I'm just going to pause now and see if anybody would like to come in at this point and contribute. I'm sure that amongst the 90 odd people, practitioners in the room, many of you think this might be a bit too easy. It's not a trick question. I really just want to locate this in the context of OP. Anybody fancy sharing the thoughts?
I could start, sorry.
Thank you, Jenny.
I was just going to say something that sort of bridges the gap between school and home, and with the child being interested in animals. So, I mean, I'm sure it's in other people's minds as well, but maybe some sort of toy that, you know, some cuddly toy or something that they could take back that's an animal that they could move between home and school to help them. And this, it could have a diary or some, you know, there could be all sorts of things linked to it.
Yeah, that's great. Thank you very much. Really good contribution. And Amanda, you wanted to come in?
Hello, yeah, thank you. It's more of a general comment, really. You're saying that a little boy N is coming into reception class. And in my experience working in the field of SEN early years, often it's the expectations of the reception class that are an issue. And that, for me, I feel needs to be something that's really written into the ordinarily available provision documentation about flexibility and about expectations and about when children don't fit into the reception model and the children not coping. And it's about the flexibility there, I guess, more generally. And you know, of all of those questions, really, about what provision you have got in place to meet the needs of children who are coming in, not children having to meet the needs of the reception class.
Thank you so much. That's such an important comment. And, you know, we talk quite often about kind of shifting the language even and saying that schools are child ready as opposed to children being school ready. And I think that speaks to your comment. And certainly one of the things you're alluding to really is the transition and transition arrangements. So I think these are all really, really good points. I'm going to take one more comment on this and then we move on to the next question, which I think is very important.
Daniel, just to jump in, there was Jenny Holt, I think a different Jenny, who had her hand up originally. I just wanted to make sure that she wasn't missed.
Oh, I'm sorry. If I
Okay.
got mixed up between Jennies, if there is a Jenny who would like to contribute now, please. I'm more than happy.
It was me, a different Jenny.
Jenny Jane,
but
sorry. Yeah.
yes, that's fine. But it was mostly what others have been saying. Can you hear me?
Yes.
Sorry. A lot of the transition work needs to kind of happen a lot earlier, and thinking about the school being ready for the child and not the other way around, really. And I think that maybe looking at, it depends what time this is as well, that having a gradual transition, maybe the child could do part-time for a little bit longer as well. And what the person was saying before, I really agree with that, about flexibility, about not forcing the formal aspects of reception, thinking about it still being the early years.
Thank you very much. Again, it sounds to me like, from at least from those contributing, we have a bit of a consensus in the room, and certainly we'll come back to transitions later. I'm just going to take one last comment from Samira, and then we move on to kind of the next question. Samira, please.
Hi, I just from the experience and the conversations I've had with Senkos in schools in the local area, it seems to me that a lot of the Senkos there's a confusion between anxiety and special needs. So when a child becomes dysregulated, they're very quick to label on that this child may possibly be a child with additional needs. I found the use of social stories to be incredibly helpful, especially with regards to pictures and images, to be to follow the child from as early as 6 months on, or from whenever a child who is known to be distributing anxiety, to be able to more acclimatize to the new environment. And that conversation about the phase transition, absolutely, completely agree.
Thank you so much, Samira, as ever, really pertinent comments. And again, social stories, I think, is a good example. What's coming out from many of your comments, incidentally, and I would like you to keep this particular comment in mind as we go forward, is that, yes, we're talking about interventions and responses to a particular need profile which is emerging, but really, certainly things like well thought out and spaced out transitions and social stories, these are really interventions, if that's the right word for them, which most children will benefit from. And that really is one of the beauties of OP system and kind of really strengthening that universal level. Because not only really, I would say that all young children will benefit from this kind of approaches, it also means that when you employ these approaches for individual pupils, they are not singled out simply by the fact that they have a particular needs profile. So this is one of the kind of the beauties of having a well thought out OAP system. Because your contributions were so helpful, we've lost a bit of time. So I'm going to possibly kind of take the reins myself for the next questions. And I think that the next important question was really about what happens if you do not provide these interventions and this support. In short, I think that most of you would agree, and touching upon also a point was made, I think, by Samira. This is the thin layer of pupils and children where we're thinking that actually there might not be genuine special needs in the way we think about them, but the special needs kind of emerge because of a lack of response. Clearly, some pupils will always need an HCP and have a more complex need profile, but certainly those displaying anxious behavior will not necessarily. And with the right kind of approaches, they can settle in and succeed and feel comfortable and safe in their school and or setting. When we don't have the right kind of intervention and responses, then we get what we generally speaking in the jargon call escalation of need. And that's the kind of thing we're looking at. Again, we can probably have a kind of a whole day seminar on this alone, so I can't do it justice, but just to give you some of the things I have in mind, certainly escalation of behavior, and that can be internalizing or externalizing. So internalizing, becoming withdrawn, refusing to go to school or to childminders, etc., or externalizing outbursts, behaviors that challenge, etc. We know there can be a big impact on communication development, continence issues, etc., and all the other manifestations we know of anxiety might have. There very often is an impact on the whole family, including siblings, especially if we begin getting school refusal. What do the parents do? What do they do about work? What happens to the school run routine? These might sound mundane points and a bit trivial, but actually they have a big impact on family life. And in turn, this can really create a self-propelling cycle of need. So some of the approaches, and I've just really plucked out a couple quite randomly from existing OAP documents. So in Manchester, they talk about attachment-informed practice. We know that many times anxiety relating to school is related to attachment issues, nurture groups, liaison with virtual school if that becomes necessary and there's already issues around attendance. In Barnett's case, I quite like this because this is almost obvious, but it's really helpful for it to be on the OAP formally. An individual plan to tackle anxious feelings, and this is something which has been stipulating formally by the local authority, and consideration of flexible start times. And I will also add, which we didn't put on the slide, we might want to consider doing it moving forward, that obviously transitions, as many of you mentioned yourselves, is a big part of it. And transition really needs to be, and actually is in law, supposed to be set out quite clearly, the transition arrangements, bearing in mind that actually children in the early years have the most points of transition in most kind of normal educational journeys, and this is probably at the time where it's hardest for them to face it. So certainly transition, I think, is well made by the group. Okay, let's move to the next slide, please, Christina. We are still running out of time. Christina, give me a note. Shall we go for another 5 minutes or so? Or?
Yeah, I think we can do another 5 minutes. I just want to recognise, I think there's a kind of conversation happening in the chat around how does the ordinarily available provision intersect with the graduated approach. So it'd be great if you could perhaps build that into the presentation.
Perfect, thank you. Let me do the slightly kind of dry bit first about the legal system, and then I'll come back to the graduated approach. So the first thing to say on a very formal level, but it's probably important and helpful to know, that the OAP lives within the local offer part of the legislation, and it's one element within it. So the local offer, for those, I'm sure all of you know, but for those of you who might not remember, not dealing with it recently, is a kind of set of expectations of information which is supposed to set out by the local authority, available mainly for parents and carers to access, and what kind of resources are in place for children and young people with EYSEND. So this one particular aspect of it is a requirement of the local authority to set out what special education provision and special training provision it expects schools and early years and post-16 providers to make available. And this really relates to, there's a whole list in the regulations, that it relates to almost any school, college and setting you have in mind, including private, independent and special schools, etc. Next slide, please, Christina. And what the code said, when you say the code, I'm talking about the code of practice. The local authority must set out in the local offer the authority-wide description of what special education and training provision it expects to be available for children and people with EYSEND. And as I say, this includes almost all providers that you can think of. The kind of things they're talking about are, what are the arrangements for funding children and young people with EYSEND, how the providers will use that budget and how they will delegate them, and setting out approaches to teaching, adaptations of the curriculum. So we're talking about differentiation and the learning environment, including the physical environment, and additional learning support for those with SEN. And again, remember, I'm talking on the universal level, not that which pulls in separate funding. Although some local authorities might have separate pots, but as far as the law is concerned, this is what happens within the mainstream provision. The breakdown of what needs to be set out by local authorities is in something called Regulation 53, Article 2, and it sets out, in addition to these couple of examples I've given you, also things, for instance, around transition, but also things like arrangements to make sure that physical leisure activities and things like playgrounds, what arrangements are made for those to be accessible, etc. So there's actually quite a lot in there. And as I say, this is a legal expectation on local authorities to make sure, really, people like you, I don't know individually who you are, but if you are a parent, carer or a practitioner, you will all have a good understanding and quite nuanced of what the local authority is expecting you to provide, and what in turn children and families can expect to be provided for them vis-a-vis the special needs at the universal level. Next slide, Christina. Okay, so we've nearly reached the end, but before I hand over to the speaker, I do want to go back to the point of the graduated approach. It probably merits me spending 30 seconds in describing what the graduated approach is, for those of you who might not be certain. Commonly, usually kind of described as the assess, plan, do, review cycle. It's a cycle of 4 steps, which has been, I would say, common practice in teaching certainly for a long time, but it actually was enshrined within the current code of practice as the system to ensure that the pupils' needs are picked up in a timely manner, and then they are addressed in a kind of ever-escalating cycle of support. So the idea is that once a cause for concern, and usually there's some kind of form in a setting or school called cause for concern, once that is registered, so the setting or the school make some efforts towards identifying what the particular needs are. That's the assess bit. The plan, put in place an individualized plan to support those needs. They deliver that, so that's the do, and then they review it in an ongoing kind of cycle. If the challenges have been overcome after one cycle, you basically go back to business as normal, hopefully with some new adaptations to learning for a particular child. If the needs remain or are accelerated, then you put in, you embark on a new cycle where there might be more standardized assessments, more refined plan of intervention, etc., etc. And the idea is that if after 2 such cycles as a rule of thumb, this is not always the case. After 2 such cycles, roughly after 2 school terms, if challenges are still in place, so then you would consider to apply for an EHCP. I suppose the link between ordinarily available and the graduated approach is you will require the infrastructure of the ordinarily available provision of the universal support for SEND to be in place in order for you to know that you need to embark on that graduated approach. The graduated approach, generally speaking, is conceived to be on that more targeted tier of the provision. Again, there is some grey area over here because it will depend what provision you want to put in place. But if you do not have clear expectation of what should be available at the universal level, it is virtually impossible to decide, do you need to do the next step? Do you need to access the graduated approach? So I would say the difference is that OAP allows you to have that benchmark. If you've passed the point at which the needs are reasonably going to be met within the universal provision, then you need to go to the next level, which is a graduated approach. And as ever, I'm just going to pause here and see if anybody wants to dispute that or ask any questions about that particular point. It's a very important point, and I'm really happy that it was brought up in the chat, because we quite often see people getting confused between the two. I think we have a couple of thumbs up. I'm going to acknowledge this is probably a bit more complex. So if after you reflect on what I've just shared with you and you kind of project it on your own practice and you feel you want to take this any further, so please just put it in the chat or ask a question later when I come back the next part of my presentation. But for now, and only slightly over time, I'm going to hand over to Christina to present the next speaker.
Hi, thanks, Daniel. Yeah, so we're so grateful to have Sue Sager with us from Cumberland Council. When we were working with Sue, she was with Cumbria, which then split into 2 local authorities. And it was a really great journey to be a part of. We actually all went up to Cumbria on a beautiful sunny day, and it was stunning to do one of our action learning sets with them. And I understand that it's been a positive and worthwhile journey, obviously had some of its challenges. So I'll pass over to Sue to explain a little bit more about their experience.
Thanks, Christina. So as Christina said, my name's Sue Seeger. I work now for Cumberland Council as an early years advisor and area SENCO. So I support childminders, PVI settings and schools. It's a kind of dual role, supporting quality improvement and also advising settings with inclusive practice and generally, and in relation to individual children as well. So as part of that role, I led the OAP project across what was Cumbria at the time. So I've been asked by Christina to reflect a little bit today on our OAP journey. There's some time for questions at the end, so if you think of anything, just pop your questions in the chat and I'll try and answer them at the end. As Christina just alluded to, we had some local government reorganisation recently. Last March we were split. So this project started as Cumbria, and then we were split into Cumberland, and which takes in the sort of west of the county and the north of the county, and Westmoreland and Furness, which is more the south and the east of the county. So we are 2 different local authorities now. So we produced our document, our OAP document together when we were 1, and we now have 2 identical documents at the moment, but they are they've got different branding. That's the only difference. Just to throw another spanner in the works, we also work with 2 different NHS trusts across Cumbria, and their split is north and south rather than east and west. So that they were both involved in our in the project, and that just makes things more complicated, but everybody was involved. Can I have the next slide, please, Christina? Thanks. So in 2022, Cumbria County Council SEND team produced their 0 to 19 OAP document for schools and settings, listing the provision they expect to be offered to children and young people at that SEND support level. as an early years team, we were sent the draft, and we felt that the terminology they'd used and the provision that they expected in that document wasn't really helpful or even appropriate sometimes for children in the early years. The document was quite clearly aimed at schools. It mentioned things like the role of the school SENCO, the role of the teaching assistant, the role of the class teacher, things like that. So although we support children in schools up to the end of reception, we didn't feel it reflected the needs of that wider early years sector, including those PVI nurseries and childminders, children's centres, and nor did it reflect those strategies that would be particularly useful to younger children. So we felt that an early years specific OAP document would better meet the needs of the early years workforce and our children and families. Christina's team at the Council for Disabled Children had been in touch to offer support with such a project, and we'd worked with them before when we developed our transition toolkit, so we were glad to accept the help. You can see on the slide here how our journey went. So I'll spend a few minutes this morning talking you through it, about what went well and the challenges and what our next steps are going to be. So in October 22, we began with a large face-to-face initial meeting facilitated by the CDC team who travelled up to Cumbria, as Christina said. And we invited a wide range of partners to that initial meeting. Have the next slide, please, Christine. Thanks. So you can see here, we invited a multidisciplinary range of professionals who were all involved in working with the early years children with SEND. As an early years team here in Cumbria, we've got close working relationships with our NHS colleagues. We sometimes do joint visits, we meet up with them regularly, and also colleagues from other teams within the council as well. So that meant we were able to personally contact those individuals we thought should be involved and explain the purpose of the project before we sent out that more formal invitation to this meeting. So we used our contacts also within our school and PVI reference groups and childminder groups to invite representatives from the sector to the meeting as well. It wasn't just NHS and council people, it was professionals from across the sector. And that meant we had quite good attendance from a wide range of organisations at the initial meeting. The CDC team facilitated the meeting for us. They did an introduction to the purpose of the ordinarily available provision documents, because for many this was the first time we'd heard of them. And we looked at the purpose. And they also, one of the most useful things was that they provided us with examples of OAP documents from other local authorities. And we had time to look at those in groups and discuss what we liked or not about each format. And that led to some really good discussion about a shared vision for how ours should look and its purpose and potential. That was a really useful activity we did there. And we all sometimes feel rather isolated in different local authorities, but actually we shouldn't have to keep reinventing the wheel. One of the purposes of me coming today was to sort of suggest some ways that we worked, and if you can find anything useful from this morning, I hope you can. With the next slide, please, Christina. So at that initial meeting, we agreed that the purpose of the OAP document was to provide advice for all practitioners, not just SENCOs or those with extra training or experience. This document we wanted to be for those on the ground practitioners who are working with those children. It would contain simple, low cost or no cost strategies that were practical and realistic, with no particular, no need for particular specialist training. We would use clear, simple language that families and inexperienced practitioners could understand. We were not going to use any jargon or acronyms. There would be a simple explanation as to why each strategy was important or useful. And this could be shared with parents in order that they hopefully would continue those strategies at home. It would contain the common advice that people like the area SENCOs, the speech therapists, the specialist teachers, the educational psychologists found themselves giving out again and again on visits. And this advice could be followed before referring to other services or whilst waiting for an appointment. We all know across the professionals are getting longer and longer. In Cumbria at the moment, it's about an 18-week wait to see a speech therapist, for instance. So we wanted something that would list some strategies that could be tried whilst practitioners were waiting for those appointments. And all advice could be used with any child. So none of the advice in the document would do any harm. You couldn't do any harm to any child by following the advice in the document. And really, it lists good inclusive practice for all. Some children will need more of these strategies than others or for longer periods of time, but it's all good inclusive practice. Next slide, please. Thanks. So by the end of the initial meeting, we'd agreed on several factors around the format of the document. We were really clear that we wanted it to be a positive document, so written from the perspective of supporting the child to do what they wanted to do, rather than from a perspective of fixing what they couldn't do. And that was really important to us. So on the slide, you can see an example of part of one page in the personal, social and emotional development section of our document. And you can see the headings. So these headings are on every page of the document. And the headings we agreed on after a lot of discussion were, I want to be able to, you could support me by, and this might help me because. So all our strategies are written in those three columns. We've written it sort of from the child's perspective, and that's also the way we write our early years support plans. So we have a format, a suggested format for support plans in Cumbria for early years children, and it uses a similar way of writing from the child's perspective. So that means that strategies in our document, in our OAP document, in that middle column there, can actually be copied directly into the children's support plans or IEPs if that is appropriate for that child. So we split the whole document into 3 prime areas. So we had quite a lot of discussion about how to divide the document up so people could find what they wanted easily. So we decided on using the 3 prime areas from the EYFS, with those strategies falling into one of those 3 sections, because we felt that all the early years practitioners would understand those prime areas and what was in them, no matter what their experience. We had discussions about other options, for instance, using those 4 broad areas of need from the Code of Practice, but we felt that those might require a bit more specialist knowledge. So the SENCO might understand them, but the other practitioners might not necessarily know where to look for something. So we use those really common to all EYFS practitioners' prime areas. We use the same format on every page, using those same column headings throughout, written from the child's point of view. The document is primarily electronic, so it would be held on our early years website, which all our practitioners know where to look for that, and on the local offer website. And because it's electronic, it can be updated, added to, and be like an evolving working document. And we've been very clear throughout our rollout of this document to our practitioners that this is a first draft, and we've asked them for feedback of anything we've missed, for instance, and things they want including. At the end of each section, there's also a short list of those key websites and documents that contain further useful information. So that initial meeting was really productive. And attendees went away telling me they were really enthused about how the document could make a difference to their service and to the families and settings they support. So before we finished, we asked for volunteers to make up 3 working groups, one for each of the 3 sections. And each of those working groups contained about 5 or 6 people with a specialism in that area, and each was facilitated by one of the early years team. So those working groups met several times, sometimes face-to-face and sometimes online, to devise the content for each of those sections and to write them into the format that we'd agreed on. And I produced a template for that format they could write into. So that main content had been developed by about February 23. There was then a little hiccup because I broke my wrist and I was off for 8 weeks, but these things happen. But once I came back, I then edited the completed document just to ensure that all the sections were consistent in the way they'd been written. And I wrote a brief introduction for practitioners on the purpose of the document and suggesting how it could be used. So by the time the document was ready, which was in May last year, we'd actually split into the 2 new local authorities. So the identical finished document was sent to the respective council's communications team for corporate branding. So can we have the next slide, please? So there, you can see on the slide there the finished articles. You can see they are almost identical. What we've got one comms team hosting the other, so at the moment they are sort of the same staff being shared, but so that's why they look pretty similar. We had a few challenges along the way, mostly to do with our particular circumstances. So the local government reorganisation process meant that our websites were split, so all the web links we'd put in them were all wrong. So that took a little bit of rejigging about. The corporate branding took longer than usual due to all the other documents that the poor comms team were having to rebrand right across the councils. But hopefully these are things that are particular to our situation. So now we had the finished versions, we needed to get the word out. So the main push started during last autumn term, before Christmas, and we did this in lots of ways and as many times as possible. So we've started by emailing the document out to all schools, childminders and PVI settings, as well as putting it on our early years web page and the local offer website. We utilised all our existing communications channels. So I delivered briefings on the OAP document to our existing PVI and SENCO and school SENCO networks, to early years clusters, to head teachers clusters, new to UFS training. I wrote pieces on it for our weekly early years updates, which go out to all our providers every Wednesday. So I wrote pieces in there, and for our termly SENCO updates. We also emailed the document to all those professionals who'd been involved in writing it from within other organisations, so in other teams in the council and NHS. And we asked them to flag it up on visits to settings as well. In Cumberland, we've also been lucky in that we've been able to find the funding to produce some glossy hardbound copies of this first draft and to distribute them to all our providers and professionals. I'm not sure if you can see that there, that's our copy. So we've sent that out to every provider through the post, every childminder, school and nursery, and also to all our area SENCOs have got copies, specialist teachers have got copies, the speech therapists, the EPs, the physios, the OTs, they've all got their copies, and they take them out and about and they flag it up all the time on their visits, quite literally flapping it in the providers' faces sometimes, in order to just keep it to the forefront of their minds. And one thing we also ask always on our visits as well is where their copy is. So we've tried to make sure that it's actually in the room, it's in the nursery, it's in the classroom, not in the school SENCO's office or in the admin office somewhere. because it is a document for the practitioners on the ground to be using. The next slide, please. So, so yes, what next? So the verbal feedback we've had has been really positive. We've received lots of great comments on how useful the document is. The settings are saying things like, as the money becomes tighter, they are beginning to be asked to show more and more what they've tried as part of the graduated approach from within their own resources before they can apply for further advice or financial support. And that document gives them those strategies they can try. If settings are requesting further finance through, for instance, an inclusion funding or an EHCP needs assessment for a child, they can show that they've used the advice from the OAP document as part of that graduated approach. And this also counts as having followed professionals' advice as well, because it's been written by the professionals and our SEND team has been involved. So it's being counted as having followed that initial professionals' advice. As I said before, our waiting times for seeing other professionals are getting longer and longer. So this document gives them strategies to try in the meantime, so that the settings aren't sort of saying, well, I didn't know what to do, and so I didn't do anything, or I didn't want to do any harm, so I didn't do anything until the professional came in, and that's not happening now. So they've got that document to support them. So moving forward, we're still getting all our professionals to continue to promote its use. In the summer, we're going to send out a survey, an online SurveyMonkey survey, to all our providers, asking for comments, but also to ask if there's anything that they feel we've missed or they'd like adding in. And we continue to look at new resources, for instance, and we can add those in. So it needs at least annual reviewing to ensure that everything's correct, to ensure those web links are still active and working. We told everybody that the online version's the most up to date. That printed copy, obviously, it was only up to date on the day it was printed. So it might go out of date in the future as we amend the online version. The two local authorities might decide to diverge in their content, although we're still in touch with each other and we continue to liaise about any amendments. Each local authority might have different strategies that they want including, or different information they want including. Have the last slide, please. So feel free to look at our document if you'd like to. We found it really useful to look at what other local authorities had done before we embarked on our OAP journey. So there's a link there to our document and a QR code if you've got that kind of technology. And we'll put it in the chat as well, the link. So I'm happy to answer any questions now. If you think of anything later and you want to email me, I'm more than happy to help if I can. And we can pop my email address in the chat, or it's on the first slide as well if you look at the recorded presentation. It's susan.seeger@cumberland.gov.uk if anyone's got any questions afterwards. But if anyone is wanting to ask any questions now, I'm happy to take any questions. I haven't been looking through the chat, Christina, so if you could.
Yeah, well, firstly, Sue, I mean, it's so lovely for us to have that update, because obviously we were working with you up till March 2023, and just seeing how far you've come is really inspiring. So thank you for sharing with us today. And I can see in the chat that we've got a lot of positive comments about what you've achieved. So a couple of questions, one from Anne. Did the initial meeting include 0 to 19 service, specifically health visitors?
Yes, we had health visitors there. We had occupational therapy, physiotherapy, children's centres. So really broad range. Who else? Educational psychologists, specialist teachers. Yeah, lots of people from speech therapy. Yeah, so lots of people, but also we did have health visitors there as well, and we worked really close with them as well.
And then another question from Siobhan. Were parents and carers involved in developing the OAP document?
Yeah, that was probably one of the most challenging parts, getting parents and carers involved, mainly just because of the practicalities of getting them to a meeting in the daytime. But what we did do is we liaised with our parent carer forum. So we sent them our draft and they looked through it before it became our final version, if you like, and had the opportunity to make any amendments or add anything in. In actual fact, they were quite happy with it, but we did reach out to them, we did talk to them. So yeah, we talked to our parent carer forum. That's how we got parents involved. One of the reasons we put that section in about why our strategies was, why each strategy would be useful, was because we wanted practitioners to be able to use that to help explain to parents why they were doing what they were doing at the nurseries, and hopefully get parents involved in continuing those strategies at home. But also that was one of the reasons why we wanted it to be in really clear and uncomplicated language too, so that everybody, parents and practitioners, would be able to understand the strategies.
Thanks, Sue. We've got a question in the chat, but I think she's also got a hand up. Jenny, did you want to come in?
Hi, yeah, thanks very much for that. That's really useful. We need something like that. Work for a local authority. I'm just wondering how you got CDC involved, because obviously at the beginning you were saying they were leading on the sessions and things, and did you have to find funding for that, or was that offered through?
Christine, you're probably
Should
in a
I
better
take
place
this one? Yeah.
Yeah. Go for that. That's my pay grade.
It's a great question, Jenny. So the this was all done through the EYSEND partnership, and like part of our work is the seminars and the training, but the other part, a huge part of it, is support for strategic work within local authorities. So it is Department for Education funded. That means that it's free to access by local authorities, and we do have funding this year to support local areas with their ordinarily available provision document. The only key difference this year is that we only work with the 75 funded family hubs areas. So yeah, I don't know which, so I can't see your
North Yorkshire.
North Yorkshire is not a family hub area.
Oh, that's a shame.
But definitely let's have a conversation, because there may be something else we can support with, or if there is funding available, we're always open to a conversation.
Yeah, that would be great. Thank you.
Any other questions? Daniel?
Thanks, Christina. This is not really a question. I just wanted to make sure that I have a chance to thank you, Sue. I think a really interesting talk, and I've seen from the chat that many people are liking the template, etc. So that's really positive to see. What I did want to do, Christina, just before we break, we might have to kind of reconsider the exact what we're doing next. But before we break, I just wanted to respond to a couple of the comments in the chat, if that's okay. This is moving away a bit from Sue's presentation and back to that question of the graduated approach. So I feel like I probably need to refine a bit both what was been said in the chat and possibly what I said myself. It's probably useful to differentiate between two things over here. One is the graduated approach as a kind of pedagogy device. And the second one is, I suppose, in capital letters, graduated approach in the sense of the way it's stipulated in the EYSEND Code of Practice and in the regulations. In the Code of Practice, the graduated approach is not part of OAP, and that is, in fact, is the point. Graduated approach is the approach settings and schools are supposed to adopt once they recognise a child has SEND. A child has SEND once you recognise that the needs cannot be met within the OAP framework, if that makes sense. So it's very clear that one is not part of the other. Where I think it becomes complicated is that any right-minded person, and I think this is what's been alluded to in the chat, would say, okay, how do you assess those needs if you don't use a graduated approach? I think that's where it becomes complicated. And I'll turn to my initial comment. You would expect settings and schools to use a graduated approach regardless of if this is part of an application for ECP assessment, needs assessment, or if it's part of simply trying to work out what's going on with a particular child. So you would expect people to use a graduated approach anyway when you're trying to assess need and meet it. But the graduated approach, as is set out in the regulations, is not part of OAP. That's precisely the point, because it supersedes it. It requires more support than that which is ordinarily available. And I hope that kind of makes a bit of order in this. As I said, I acknowledge this becomes a bit murky, because you need at some point to move from what is universal to start considering, do you need to provide extra support? But I hope that has made a bit of sense and order in the question. Over to you, Christina. It feels to me that maybe we can take a break and kind of come back with a conversation after.
Absolutely. And just another big thank you to Sue for joining us and for that amazing presentation. I will circulate. Are you happy for me to circulate your email as well in the follow-up? Brilliant. And you will get access to those slides at the end of the session as well. I think let's take a slightly longer break because we have the time. So come back at 11:10 and we'll do a little bit of sort of a poll to see where everyone's OAP is, and then we'll do a discussion after that. Thanks, everyone.
Thank you.